We focus very heavily on increasing of clinical skill support. And so having a really good view of where that clinician may be with their clinical acumen is super helpful for us because we know where to focus with them on helping them to improve further, provide that positive feedback so that they can continue to provide the robust services that they are.
Eleos has the potential to make me a better therapist, and that's pretty important to me. When you're first training, you have a lot of opportunities for feedback. I mean, someone's in the room with you, or there are two-way mirrors, or all kinds of teaching devices. And then that stops. And I think in some way, we come to a bit of a halt in terms of our development.
My goal in treatment with people is to build relationships. They are going to get the most benefit out of me having a relationship with them and being heard than it would for me to pull out all the CBT and all the different modalities. Of course, I know them, so I do them just naturally, I think, but I didn't realize how much I was using them. And so when I saw that and it was like, therapists use emotional regulation technique or therapists use whatever, I was like, I did that kind of thing. Yes, I was like, and then I thought about it and I'm like, that is what I do. If I were to equate it to a therapeutic model, I am doing those things. My mind just doesn't think about it as I'm doing it.
It also teaches me some things that maybe I've forgotten since I've been in the field for so long, terminology and things like that that have happened within the session.
Eleos is the feedback system. You not only hear the notes from Eleos, you also get some analytics about client engagement. So they give you a percentage of how much the client was speaking versus you. And so you have a sense, if you're doing the session all by yourself, it's right there in numbers. They analyze the words, so they have a list of the keywords that I use during the session. And then they also have a list of the keywords the client used. I always look at that because it just seems to me, if they're very different, I need to stop and think about that. Maybe my attunement isn't what I thought it was.
I myself don't recognize what I've done at times during sessions. It's letting me know things I've done. Let's say I haven't done too many open-ended questions or closed-ended questions, or the amount of time that I speak. And it creates confidence too, because I'm like, oh wow, yeah, I am being a clinician. I am doing my job in this. It's helped me to be a better clinician. Letting me know what are the skills I am providing for therapy has really benefited me in trying to become a better therapist.